So eating healthy is an idea, and
Right.
it's an idea that everybody has that's very different. And just
Right.
because you eat healthy doesn't mean you're eating enough for what you're doing.
You're listening to the Active Mom Podcast with host Dr. Carrie Pagliano. I'm a mom, physical therapist, and your go-to guide for staying active with pelvic health issues in pregnancy, postpartum, perimenopause, and beyond. Whether you're a fellow mom, physical therapist, or women's health professional, join me where I'll share expert insights, real-life stories, and the latest research to help you approach running, CrossFit, yoga, Pilates, HIIT, or whatever activity you love with confidence and evidence-informed guidance. Let's start the show. All right, welcome back to the Active Mom Podcast. We have a returning guest, and we had to do a little brainstorming on when you were on. Dr. Kate Mihevc. I always screw up your middle.
Everybody does.
Please try. Do it for me.
It's okay. It's Mihevc.
Mihevc. See, I don't read it that way, and that's the problem. So Kate Mihevc Edwards, we're just going to go with Kate.
We're good.
She was on the podcast previously chatting about her book, Go Ahead, Stop and Pee, but we're back a couple seasons later. She's got some cool developments with stuff that she's doing with apps and programming and a new podcast. She's a PT that we're kind of bringing over to the dark side. I feel like you're a pelvic PT, but you're not. Might as well be. But she's a running PT, so we'll bring her into the crew here. So, Kate, welcome back to the podcast.
Thank you, Carrie. I'm so happy to be here. And this came from the Female Athlete Conference.
Yeah,
We were hanging around talking. And you were like, "You really need to come back." And I said, "Well, that's a great idea. I'd love to."
yeah. So let's start talking about. Well, I think we'll go backwards. We'll start with the podcast
Mhm.
because that's kind of what we got to talking about at the Female Athlete Conference, was that you had this idea for a podcast. And podcasts, it's one of those things that, like, it sounds really good until you have to pull it together. And then you realize how many moving parts there are. And you're doing it in a case study format with multiple providers kind of pulling this picture together. So
Yeah.
start with a little bit, like just a quick blurb of your background in case anybody needs
Sure.
to go back and listen to season one. And then what made you think to put on the headset and grab the mic?
Yeah, sure. That's a good question. Um, so I'm a running medicine physical therapist in Atlanta. I own Precision Performance Running Medicine Clinic. We have 2 locations. I am adjunct faculty at Emory University. I've done some research. We have a paper coming out about thoughts, beliefs, and attitudes of runners, and we're looking at that in conjunction with how that the gap between what runners believe and what we do as healthcare providers. And we're trying to learn how to bridge that gap. And I have a running app, which we could talk about later, called RUNsource. V2 is coming out, I think, next week or the week after. Amazing. But then I work on multidisciplinary teams all the time. So I helped build the Atlanta Track Club Elite multidisciplinary team. And we have a sports psychologist, sports dietitian, MDs, my physical therapy team, coach, chiropractor, and the head of performance. And we work together on a regular basis. And we talk about our athletes to work together. We think about, like, okay, what could they benefit from the most? And we work together as a team all of the time. So this year, we actually had 80% of our team PR, and we
Wow.
have had injuries decreasing every year, year over year, since we started this. And that's why performance is better, because we have less injuries.
Right.
And so this kind of ecosystem that we've built over the last, it's almost 5 years now, has really changed a lot about, what we do in practice in my clinics, and why I built the RunSource app, but then also why this podcast has come up. So 2 of the people that I've worked with on this multidisciplinary team, Dr. Sarah Reiser, she is a running medicine physician out of UVA. And then Kelsey Pontius, she's a sports dietitian who lives in Boulder, Colorado. So the 3 of us are good friends, and we're constantly calling each other about cases, and we've worked together a lot on cases. And it's not uncommon for Sarah to call me from a treatment room, or Kelsey to call me while she's on a call with a person, or vice versa. And so we've done this for so long, and we realize that most people don't get to benefit from an interdisciplinary team.
Right.
And it's not a common thing, and it's actually not how most people practice in healthcare
Yeah.
either.
which is disturbing. We could have a whole podcast on that.
Yeah.
Was that anything, to come up with that for this particular group? Had you participated in that previously before, or did it just kind of come out organically?
So I've been doing it without
Yeah.
having a name for it for years. And
Yeah.
so, it's like one of those things with patient, you say, okay, well, we really need to pull in a dietitian and we really need to talk to the
Hmm.
physician. And I found that with my clients, there was not a lot of crossover. And so I would start calling all the people that they were working
Yep.
with. And in our intake form, we say, who's on your team?
Right.
And I would start calling or emailing these people, and then we would just start working together. And that's
Hmm.
what we've done in Atlanta. And then because of that, we started to think about it for the track club. And so it organically happened
Hmm.
because it was working. And
Right.
I didn't realize it was something that people didn't do
Right.
until they started saying, like, wow, you really talk to other providers.
Are you kidding me? I so this is where, again, this is where you're going to be an honorary pelvic PT. Is I feel like in the context that we work, and you work with pelvic PTs all the
Mhm.
time,
Oh,
is we're kind of, I feel like we're the social worker because we have to pull everybody together. You need to talk to the urogynecologist, the colorectal doctor, the ortho PT, the running coach. Like, I feel like we kind of have to do it anyway because we're pulling stuff together. So for us, and that's why I love the idea of the podcast, is because I'm like, I think if you're that person that you want to have that full picture, you're going to drive for that anyway. Sometimes if you work in a hospital-based practice just because that's, the culture and the ethos of the facility, you get to do it. But it really has to come from that, like, I don't know, desire to have that full picture and get the whole team together. And other disciplines are really cool people. Like,
it's so cool, and I learned so much.
yes. Yeah,
Um,
yeah.
and that's the best part. So,
Yep.
yes, we just decided, why don't we let other people see what we do on a regular basis?
That's awesome.
And all of us that are on this podcast, so Kelsey, Sarah, and I, we are commonly the person people come to last, much like yourself. Like, they've
Hmm.
been to several other providers.
Right.
And they've been through the system and the things that don't work. And
Right.
so all of us here on a regular basis, oh my gosh, I wish I had met you how many years ago. And so we thought, well, maybe we can offer our knowledge on a
Mhm.
level that people can hear these things and know what to ask their
Right.
providers, and know that there's a better way out there.
Yep.
Yeah.
Yep. No, I think that's a really interesting approach because I think as providers we're really used to, listening to like case conferences or things like that where I think that's a little bit more normal setting, but the average person, again, they may not. I mean, I had a client yesterday. Oh my gosh, she was given one diagnosis. It was literally 180 from what it actually was. And her partner was friends with me and he's like, just go see Carrie. And so she did, and she's doing great. And I was like, you know what, you just saved yourself. And she's like, what do you mean? I'm like, average of 3 to 7 years to get to the right provider. She's like, you're kidding me. I'm like, no.
Is that what I didn't know that that was the stat.
With a lot of, I mean, if you go back to a lot of things with like, I think it's getting better with certain things like endometriosis and things like that. Like just to get a proper diagnosis, it can take that long. I mean, the number of providers, I'm sure you have stats on that. Like it can be in the teens, it can be in the double digits as far as number of providers to get to somebody. And when I was asking this person, she's like, you know what the biggest thing was? She's like, you listened to me.
Oh my God, that
And I
is
was like,
actually shocking, but that's what I always say I do best, is listen.
well, exactly. And I think that's, again, that's what I feel like it's such a good mashup when you have multiple providers,
Mhm.
somebody's seen a bunch of other people. Like our job as the detective is to figure out, okay, that didn't work. That didn't work. Okay, well, there's a gap here. It's really fun. You feel bad for them because it's taken them so long, but it's actually really fun to be like, all right, that didn't work because of this. Let's fill in the gap here. Like it's,
Yes.
I like it.
No, I love it. I actually love it. I love those cases because you get to figure it out.
Yeah.
And then also you get to be the one that helps them get back to whatever it is
Yes.
they
I
love.
know.
And they're so happy.
I
And
know.
and it's just it's really fulfilling. Like that's why we got into this. That's why I got into this as a profession, is to help people. And that sounds
Yeah.
cliche, but it's true. And when you take the time to listen and you take the time to connect with other healthcare providers and you really look at the entirety of the case, you can
Hmm.
help so many
I
people.
know.
Yeah.
I know. It makes me sad. All right, we're gonna talk about perky things now.
Yeah.
Um, so let's take this back to the logistics of a podcast with multiple people.
Oh my God, it's a nightmare. Okay, so I had a podcast before. It was called More Than Miles, but it was
Mhm.
Casey and I, and we worked together and it was easy. We could do it in the
Right.
clinic. And we also just did it for fun and for our
Right.
patients and that kind of thing. This is
Yeah.
a different idea.
Yes.
This is something we want to grow and get big because we want to help as many people as possible and really show the world what healthcare can be like.
Right.
And we want healthcare providers to be listening to this. We want
Hmm.
coaches to be listening to this. We want athletes to be listening to this. So this is just a different animal.
Yep.
And when you have three people who are so busy because two of us own our own businesses or
Hmm.
multiple businesses, and one is a physician at a very busy clinic, but then is also flying all over the country and
Right.
world to
Yes.
cover events and do conferences.
Hmm.
Finding a day where the three of us can sit down could take us a month.
Oh, I believe
And
it. I
that
believe it.
we had this great idea where we might release every week, and then we realized it was
You can't.
completely impossible.
Yeah.
It has to be once every other week, and we have to sit down and record at least three
Hmm.
podcasts when we sit down, because if we don't, there's no way we'll get these out in the
Right.
world. It's just
Yeah.
too big. Our schedules are too busy.
Well, and that's why to bring this up is it's a demonstration of the sheer dedication you have to the task at hand because it's not for the faint of heart. Scheduling and as a mom,
Oh
you
my god.
are a esteemed, experienced project manager.
That is the truth.
Yes. So I know that you have that skill set in your toolbox, but like, yeah, this is kind of next level.
Well, and this is the other piece about it. So I convinced these women that I love to do this. Neither of them wanted to do it at first, right? And I said, we need to do this. And so
Yes.
what happens is when you're the one that convinces everybody to do it,
Hmm.
you're in charge.
Yes,
And
you are.
they don't have the capacity because of their busy
They
lives.
just need to show up, right?
Right. So all they do is
Yep.
show up and have the
Yep.
conversation. What I do is, talk to a sponsor, and I have to plan the cases. And, I
That
ask
would be
them.
the hard part is the planning of the cases, I think, and just making sure that you have all the details that are going to make that make sense for other people. So when they're listening, like, oh, what about that? Or yeah, to really get people engaged, you want that meat in the story because you're essentially storytelling.
That's exactly right. And
Yeah.
so I actually had this great idea where like I was going to do a Google Drive, and I put in everything. So I put in, here's all the marketing material, ladies. I will put together all the videos from our editor. I'll put them in here. I'll tell you how to do it. This is the folder for all the cases. You get to add the cases you want to add and all the details. And like I did all of these. Here's for our YouTube channel. Do they even know where the folder is? No, they don't even not know, they do not know where the folder is. And I hope they hear this because I love them so very much, but they don't even know where the folder is. I have sent them the folder no less than 5 times.
Mhm.
I mean, I give them everything, and in the end, I just know I'm going to
You
be
just
doing it.
you just need their brains. You need their brains in their cases.
That's
Um,
right.
so you guys have had some time to record some episodes. Like, what
Mhm.
are some of the for you kind of what have been some of the aha moments where you're kind of just when you talk this stuff out loud? Because I feel like having a chance to kind of reflect back on
Mhm.
cases, even though it might have turned out well, you still kind of pull these little
Yeah.
nuggets from it. Can you give us some examples just to, as a little bit of a teaser so people can pop over? And of course, we're going to link everything in the show
Yeah,
notes.
sure, of course. So I think the next episode that's coming out this Friday is marathon runner Red's case, postpartum. So postpartum
Ooh.
runner had Reds, have some pelvic floor stuff. Like it's a really big case, and there
Yeah.
were a lot of moving parts. So this was actually what gave us the idea to start the
Yeah.
podcast, is this case, but we didn't start with it. I think it's the third one, and it was somebody that we all worked with together. And so going through that case, I realized that we were not as cohesive working together as I thought we were initially.
Mm.
And there were a lot of signs in the beginning that we caught and
Yeah.
that we knew what was going on, but maybe we weren't able to act on as quickly as
Okay.
we should have or could have,
Yeah.
because of all the circumstance. And sometimes, even looking back, maybe we did the best that we possibly could
Yeah.
have, but I think we could have tightened it up a little bit. Like, if I
Yeah.
looking back, I feel like this timeline could have been shorter. We could have pulled certain people in earlier. We
Yeah.
could have rallied the troops and said, okay, some of these things that you're dealing with are reds, even though they don't seem like it. No, we don't need to add this other provider because it's not something we don't know. We know this is a reds thing,
Yeah.
but with a reds case in particular, there are so many signs and symptoms that come with a reds case that a lot of times, if physicians or other people that are involved in the case, or even athletes, don't know why they're having these symptoms, they start chasing after and going to all
Yeah.
these other providers. So
Yeah.
sometimes what happens is, we're lucky that we can often contain it in our group because we have so many providers, with,
Right.
say, the Atlanta Track Club. But if you can't contain it, all of a sudden that patient is searching for the one answer, because they can't
Mm.
really conceptualize that what's
Right.
going on is actually the same thing we're talking
Yeah.
about.
So for people that, can you just give us like the quick down dirty
Oh yeah,
REDS diagnosis? We've had people come
yeah.
talk on it before, but in case they haven't listened and they want to hear more, what would could you just give us the definition there?
Yeah, so it's a relative energy deficiency in sport, but really what we're talking about is low energy availability. And
Mhm.
so it's about making sure that our fueling is matching what we need for everyday life, plus the exercise and things that are happening. And so, for instance, a postpartum mom, we know that they have to actually fuel more, especially if they're breastfeeding. So you have to add anywhere from 300 to 600 calories in your diet to breastfeed. Plus, we have to think about, okay, is it the possibility of bone stress injury because of how the
Mhm.
calcium is being leached from your bones because of the breast milk that you're producing. And so REDS in general is this big overarching picture of, okay, what happens in every system of your body. It
Yeah.
can impact your brain function. It can impact your musculoskeletal function. It can impact your gut. So a lot of people have gut issues, but they don't necessarily relate that to a red symptom, or
Mhm.
they're maybe they're struggling with sleep, and they don't realize that struggling with sleep is also a red symptom. But then again, if they have a small child, it's also because you
You're
have a
not
small
sleeping anyway.
child,
Right.
right? So it's reds is really difficult from a provider standpoint, but also from an athlete standpoint, because many of the signs and symptoms are everyday signs and symptoms of being a mom,
Right.
of being an athlete.
Right. Yeah, no, we're talking to Rebecca McConville later on today. She goes by, I think, Rebecca Dietitian on Instagram, and how we got to chatting was Reds in pregnancy, and I think it's just one of those things that like I start to see it on, and I don't know if you see this with just like everyday moms. I think the word is getting out there about fueling, just in general in running, I
Mhm.
far better than like, 15,
10
20
years
years
ago,
ago. Yeah, well, even that, right?
3 years ago.
But it's interesting, like in running Facebook groups and things like that, when people are essentially, I mean, you can see it. They're describing like they've had some bone stress injuries, maybe they had an eating disorder in the past, things like that. Um, and when you see other people suggest diet, and maybe they're pregnant or postpartum, like, oh no, no, my diet's fine. It's funny because there's people that are like, hey, look at this, but there's a lot of, oh no, that's good, it's totally fine. It's like I think I would have to really sit down with that individual and their individual circumstances and stressors and,
Yes.
fueling and sleep and, what are their expectations? Are they overtraining? Like I don't think I could just blow anything off and be like, yeah, no, everything's fine.
No, and me neither. And what's interesting about this podcast is hearing Kelsey talk about how she manages rest, because, and also
Mm,
how Sarah talks about when she's with a client, bringing up nutrition is really hard for her as a
yes.
physician, because the client doesn't necessarily want to hear that, and
Right.
or they're not ready to hear
Yep.
it because they think that everything is fine. I eat healthy. That's the and
Mhm.
that's what people like to tell me too, is when I ask about diet, and I'll say, okay, so have you spoken to a dietitian? What's going on
Right.
with your fueling? They'll say, oh no, I eat healthy. And so eating healthy is an idea, and
Right.
it's an idea that everybody has that's very different. And just
Right.
because you eat healthy doesn't mean you're eating enough for what you're doing. And I
Right.
think that that is something that we definitely need to talk about and have conversations about,
Yeah.
is oftentimes we need more fuel than we think
Mhm.
because of the things that we're doing, because of the life that we're living as an athlete or as a mom.
Right. But even just expectations of, how much somebody should be running in postpartum or how much sleep somebody should be getting or how hard they should be working to lose that weight. I mean, I feel like there's so many you have to dive into almost the psychology of the
Yeah.
expectations piece and the mindset of that individual. I mean, I can totally see where this particular case made you be like, yes, there's so much stuff to talk about. Um, and I think just even the average person, maybe who hasn't even ever heard of Reds before, just to kind of hear people hash out how many systems and how many of those symptoms overlap with, hey, you're a new mom and you're navigating parenthood and all these other stressors and not sleeping and food looks weird and all of this stuff. Like I can't even imagine how beneficial that might be for somebody to hear that and be like, oh wait.
Well, that's what we're hoping, is that it
Yeah.
is, because the more times you hear it, and
Hmm.
if you hear it from a context of healthcare providers, and what we do is we talk about exactly what you just said,
Yeah.
thinking about stress, thinking about how does that athlete feel is very important. How do we
Hmm.
want to approach the situation, but what do we do, because it depends on that human in front of us.
Right.
Yeah, and what we know we need to talk about,
Right.
and how do we get them to come back into the office so we can continue to have those conversations while
Right.
we're building our relationship, and while we're trying to slowly give them the information they need, but they may not be ready for.
Right. Because the last thing you want to do is shut them down
Mhm.
that they don't want to listen anymore. And I think that's the fear lots of times is that providers that don't understand running or things like that. Oh, if I say something, they're going to shut me down and tell me I can't run anymore. And I feel like there's so much mental health value to having activity. And of course, we have all our postpartum guidelines now that say activity is good, but can we have some guidance how to navigate these little minefields and how to do it a little bit better? So,
Well, and I think it's very individual, and we know that someone
mhm.
who is postpartum is not going to be sleeping that 7 to 9
No.
hours. They're just not. I mean, the reality and the research don't always match, and that's part of the art of being a clinician that works with
Yeah.
athletes and moms and postpartum, is we have to understand. Okay, this is what
Yes.
the research says. This is your life, and how
Mhm.
can we find the middle? What can we
Yeah.
do so that you can be successful and be
Right.
happy, while taking that research into consideration. It's research
Mhm.
informed. It's not evidence based. It's research
Right.
informed.
Yeah. Yeah. No, definitely. And I think, I mean, we were once PTs that didn't have kids and you're like, well, just sleep when the baby sleeps. And why can't you carry them on the other side? And like the
Right.
things that I'm really sorry I ever said. Sorry. Um, and I think that kind of plays a role too, because you're like, all right, the headspace that they're in. And how do you gently bring them around to what's going to be best for them and you know giving recommendations that are unrealistic and just
Right.
plain dumb.
Well, look, my son is 11 now, but he woke me up at 2:30 in the morning last night and crawled into bed and said, "Mommy," he said, "Mommy, I'm having growing pains. Can you help me?" I
Oh, poor
know. And
little
so
man.
of course, it's 2:30 in the morning and I've got a lot to do today, but
Hmm.
I'm clearly going to let him crawl into bed with me, and I'm going to rub
Hmm.
his legs. I'm going to, rub the quads, work on the knees, because that's what he wants. And I'm going to give him a little Tylenol, and then he falls asleep and I don't. But
The rule in our house is, because my daughter has a tendency to come back in about 25-30 minutes after I've gone to sleep, and then like just show up right in my face. Which, for those of you that you still have little ones and you're listening to that and you're like, yeah, that's totally normal. How are you not okay with that? Well, eventually you get to be not okay with that and you get some sleep again. And
yeah.
when she asks me for things, like God forbid if she gets sick somewhere in that like 45 minutes after I've gone to sleep, we've had conversations like this where I'm like, look, honey, I'm not at my best. I may tell you no. I may tell you to go back to bed. You just need to be patient with me. I will come around, but it's going to take me a hot second to do that. So if I'm really mean, I'm sorry. I promise I will help you clean up your vomit if that's what's going on. It just may take me a minute. So please be patient with me.
That's funny.
Yeah, that's how we do it now, is I have a disclaimer.
I'm not quite there yet, but I don't know. And also because I only have one, I don't know, and he doesn't do it very often, so I know
Oh,
that
mine doesn't either.
yeah.
But yeah,
So
no, she did for a little bit. But I also, I'm enjoying my sleep now. My oldest, who's about to be 15, I can't believe I'm saying that. He did not sleep the first 5 years of his life. So I feel like hopefully like I'm getting that back, but he also is getting it back too, because he'll sleep till like 11 on weekends. So, but he is not one that ends up in my face. It's my daughter that's like right there. I'm like freaking out.
oh, it's very scary when they get that
Oh, it's
close
horrible.
and you're asleep. Yeah, last night I was like, oh,
Yeah, but it's amazing. They did it when they were little, and you're just like, all right, whatever, So
that's right.
at least we do grow out of that. All right, so talk to us about the app that you are working on, version 2 of the RUNsource app. I think also I commend you for taking on an app. I heard it's not for the faint of heart. I think that's what people get frustrated about with apps, is they love like the accessibility and the click on their phone to just click a button, but do not understand the back end and versions and updates and how hard it is to put it in this like.
It's so hard.
Yes. So tell us first what it is, and then you can tell us about your growing pains.
My growing pains, yeah. So the RunSource app, I created it based on this idea that not everybody has access to a multidisciplinary team. And we all have so much knowledge, but it's scattered. So you have this great podcast and you have this great platform, but if people don't know about you, they're never going to get here. And it's the same thing with, I'll use Kelsey and Sarah because they're also on it. And you're on it if I didn't say that. So Kelsey and Sarah, if they have never been introduced to them, they don't know that there are, physicians and dietitians out there that understand runners. And so I just was in this multidisciplinary team, and then I stepped out and I realized, wow, nobody has this. Really, I mean, really, people don't have access to this because of location, maybe. So they might live in the middle of nowhere. Because of cost, a lot of these experts are expensive to access, or they just don't know they're available. So I created this place where we could all share our knowledge and put these together. And I created programs within it. So, for instance, I created injury programs. So we've got Achilles tendinopathy, for instance. But the Achilles tendinopathy injury program is based on, so it has, strength and mobility, but it also has every week videos from experts about overtraining or shoes or nutrition or maybe a meditation, maybe something, a mindset cue from a sports psychologist. So it brings together all the pieces that we don't even get to do in our clinics, honestly. And information from all these experts into these programs. And it's really cool. Obviously, I think it's cool. I love it because it's something I actually even ask my patients to use, because even I'm not trying to take the place of what we do in
Right.
any way, shape, or form. And I think I have to be clear about that, because we'll never take the place of actually coming in and seeing someone in individualization, right? So individualization of care. This is a general platform, and it's going to give you guidance that you don't have. But if you have a physical therapist that you love and trust, you're going to follow what they're saying, but then you can use the supplemental information from this app to back it up. Like maybe you can't have access to a dietitian or a sports psychologist. So then you have the resources from them that this app offers. And so V1 was kind of that, let's just get this out there. Please, God, I am so done with how much work this is. And I love my experts, but also chasing an expert for a video, it could take 6 months or a year to get
I'm
them.
sorry.
No, you're not even, you're, no,
I'm
no,
not the bad one.
you're not, no, like you're actually fast and you probably were like 4 or 5 months, right?
Oh,
But
I was slow.
yeah,
Sorry.
but that's what I'm saying though, is if you want expert information, you have to
Yeah,
have the patience to be with those experts
right.
and wait for it. And I've done that. And so we have 522 videos,
Mhm.
pieces of content in this app. But then, so this version 2, the difference is it finally looks good. The first version, I hated the way it looked the whole time, but I just had to get
You
past.
don't know until you get it out there, and then sometimes you just need to get it out there and be like, "No, I hate that."
Yeah, and I did. I hated it. And so it doesn't look the way that I want. It didn't function the way, for God's sakes, you couldn't search. What? I didn't even know
It's the
that we
things
didn't
you
put it
don't know
in
that you know.
there.
Yeah,
So there were
yeah.
all these things that I learned from version 1 and I took feedback from and I fixed it on version 2. And so
Mm,
now the cool thing is the technology that we have, we didn't have when version 1
right.
came out. And so
Yep.
now we have AI in the background helping to speed up search functions,
Oh, that's
helping
nice.
you to, so you do like an intake when you go into the app. Like if you have pain, if you don't, where is it? And all these
Mhm.
questions that I would ask my
Yeah.
patients. So you basically do an intake with me and then it sends you for you videos based
Mhm.
on the intake that you've given and it'll suggest maybe a program that you might want to go into. And then also there's a couple AI agents that I built in that can answer questions.
Mhm.
But the really cool part about this is what we know about AI is it's amazing, but it doesn't really work in a lot of ways.
Right.
Um, so the agents that we built only pull from the content that I've given it
Oh,
and the
that's smart.
spreadsheets that I've given it, and it says I don't know if it doesn't have the content
I like that.
and it'll
Yeah.
say where it came from. So if it pulls from a video that you created, it'll say,
Mhm.
Carrie Pagliano said this, and
Mm.
here's where the video is so that you can
Okay.
actually hear it from the expert. And then it also has, here's the link to or here's the research paper that we
Mhm.
use to give you this answer.
Oh,
And
that's nice.
so it's a way to, you could go out to Chat GPT and ask these running questions, but it's not a closed container.
Yeah.
It's not expert
It
backed.
hallucinates.
It hallucinates. And so ours is expert backed. You can ask it questions. It'll say, I don't know. And then if you ask it questions it doesn't know, then I get that information and I can create a content to give you
To
those
address that.
answers.
Yeah. That's
Um,
that's a smart way, I think, to use AI. There's a bigger side conversation about
mhm.
AI in rehab. And I do think that like something like this, when you have that controlled amount of information to be able to search through a large quantity and extrapolate information, I think that's incredibly intelligent. That's super smart. But like the average person does not realize ChatGPT makes shit up. Like I've been bitten 3 times now, and I'm like, oh, okay.
Yeah,
It
it does.
makes shit up.
It makes so much up. And if the whole point of this app is that it is from the expert. So I
Yeah.
couldn't use AI in the way that people are using AI because
Yeah.
then it wouldn't be from experts. It would
Right.
be from some random place. And so
Exactly.
and that's not what I believe. So I did spread, like you should see these spreadsheets, Carrie. Holy, like
Oh
my
no, I believe it. I believe it.
my clinical reasoning spreadsheets are in this. So I took my clinical reasoning and you can, I named the agents. One is Catherine, which is, me, and one is Andrew, which is my son's name. And Catherine is, a pain pattern specialist. So you put in, where
Okay.
is your pain? And it will ask you a bunch of questions. It'll say, okay, this is what it could possibly be. And this is
Mhm.
why. And it'll say, this sounds like a bone stress injury. You need to see a physician.
Oh, that's nice.
And it's because if it's a bone stress injury, you might need an MRI. And so, like it
Mhm.
says, or hey, you've asked this question several times. Don't you think it's time to see a PT?
Oh, damn. Okay.
So those are the things I'm building into it because it'll give you
Okay.
information. But one of the things is again, which is why this research paper that I'm working on and all these other things is like there is a distrust between healthcare providers and athletes. Um,
Mhm.
And we need to bridge this gap, and that's
Yeah.
part of what app is doing. And only I have to look up the new numbers, but in, like, I think last year it was 25% of athletes actually sought out healthcare providers, and they 75% looked for information online at
I
Google and
believe it.
ChatGPT. And so what I'm trying to create is a place where you can actually go, quote, online or
Yeah.
wherever in an app, and get the information you need, learn from these people,
Mhm.
understand that we're not out to get you, and
Right.
then be told when it is appropriate to see a healthcare
Yeah.
provider, and maybe who those healthcare providers are, because you're on the
Right.
app.
Yeah, no, I mean, there's so many things I'm thinking about. Like, again, there's some Facebook groups that I'm
Oh
in,
my
and it's
god.
interesting because they have nothing. They are not running. They're like following a podcast.
Yeah. Yeah.
No, like I'm serious. Like, I think it's and I love this Facebook group. So not to call it out or anything, but like the Alley on the Run podcast group, love it. They're asking medical questions and they're like freaking bananas. Like it's crazy how many questions they ask in there. And a lot of them are pregnancy postpartum ones because there's a lot of women in there. And so, I'll pipe up from time to time, but the number of people that ask about Achilles issues, hip pain, this and that. And it's so interesting because lots of times people will mention, oh, well, like Dr. Lisa has blah, blah, blah. And we've had Lisa Mitro on the podcast before. Just like they'll refer to other people, but then you have some people that give you like, well, I did this and it worked. And they feel very confident in that. I'm like, yes, but like, who are you?
Well, actually, that's what this research paper that we're almost. I just wrote the discussion like
Yeah,
2 weeks ago, I think.
yeah.
And this is actually what the research paper is addressing. Is we looked at chat groups and research papers that looked at chat groups and online forums, and and looked at what were the answers given about medical advice,
Mhm.
and almost always it was wrong. So like people will say stretch your hamstring, they mean their quad, or they'll say, so they'll be giving advice about and using medical terms incorrectly. And so
Yeah,
this is part of the issue, and that's why this app is so important, and these podcasts are so important, because
yeah.
people want to help and they use their experience to help others, but their
Mhm.
experience is different than the person they're advising, because the person
Right.
they're advising has different stresses, different life, different body, different fueling, different strength, different training program. And so just because it worked for you doesn't mean that it's going to work for the next person. And I understand that you're just trying to help, but
Right.
that just trying to help is creating the problem, part of the problem. And I
Yeah.
hope people don't get mad at me for saying that, but that's why we really need to lean on our experts and things like this
Right.
RunSource app. But don't download it until 2 weeks from now, because it will be
Okay.
version two.
I think by the time okay, so this is going to go out later than 2 weeks from now. So if you just listen to that, it should be okay. Double check with Kate.
Yeah.
We should be
I just don't want them to
fine.
see the version that's not great. But if it
So
doesn't have an AI agent and it's not beautiful, then it's not V2 yet.
if Catherine and Andrew aren't there, just wait. They'll come back. No, it's funny you bring that up. There was a paper recently on oh, and it's killing me that I don't remember who published it, but it was looking at just looking at the Instagram hashtag for diastasis recti, which is abdominal separation, just at Instagram. And I think they found that like, and I forget how many thousands of posts that they looked at, 60% of the posts were not based in any sort of evidence
Oh my
whatsoever.
goodness. Yeah.
And I feel like again, there's such, I think, crossover between what we experience in running and then what we navigate as women, because it's a a set group of people, and with diastasis, for example, you have tons of people selling programs that just because they navigated theirs, you can too. And for 1995, and I feel like running, you have that too. It's like just because you can run fast doesn't
Oh.
mean you know what the hell you're talking about. I'm
Oh.
going to throw that one out you and let you talk about that for a second.
Boy, you're hurting my soul right
I
now.
know. I'm like, let me just throw this bomb out there and let you play with it.
No, that is actually a huge problem. So, um, a lot of coaches out there, a lot of, and boy, I don't want to make anybody mad. I really don't. But
You
the
won't.
truth,
Safe space.
but the truth is just because you're good at something doesn't mean you're able to teach another person or able to drive that program. And it happens all of the time in running, all of the time. And this is again where multidisciplinary team and multiple perspectives are really important,
Mhm.
because somebody who runs fast might have a natural ability, and what worked for them might not work for somebody else. And a lot of times, unfortunately, running culture can be this push through, push harder, do more mindset, which again, we have to ride that line. If you're a professional runner,
Right.
you have to ride that line of injury and performance. Okay. And we understand that. But you also have a lot more resources in order to do that.
Yeah.
You have, hopefully you have a lot more resources to
Right.
do that. Not all the runners do, professional
Yeah.
runners do, but as an everyday athlete, the things that professional runners do not apply to you. They don't, because you don't have the same resources and accessibility and probably genetics
Yeah.
to get you to that point. And they're doing things so differently. So yes, just because you're good at something doesn't mean you have the ability to teach
Yeah. No,
others.
and again, I feel like everything that you just said you could apply to the postpartum space. Is like just because they look that way in postpartum doesn't mean they did anything special. They just might have amazing genes, and that's great. No, I think that's a barrier too sometimes, for a lot of people that are actually really good in some of these spaces, is initially they don't get as much kind of airplay, so to speak, because maybe they're not an elite runner, or they don't have the paces, or maybe they don't run 5 days a week or something like that. Um, that somebody's not going to pay attention to them, but they actually have the better information because that's not sexy. Somebody looks at this is who I want to be. They're fast. They got back to their baby weight. I want to see that. That's sexy. That gets the attention. And I feel like that's where we're sitting for so
Mhm.
many things right now in society. And me being one of those people that, no, I do not run every day of the week. No, I am not fast. No, I don't lift stupid heavy, but I show up, right?
Right.
That ain't sexy.
No, neither is what I do. Okay.
Right?
I mean, I can't run. I used to be in that category of like, I ran the Boston Marathon 3 times. I did,
Right.
13 marathons. And then I had my heart thing. So then I couldn't run at all for years. And I'm still treating runners. And now I
Right.
run a little bit, but when I'm running, it is not
Yeah.
what it used to be. It's like,
Yeah.
2 miles, and it's a walk run because my cardiologist, that's all they'll allow me to do. But so I often think to myself, like, okay, there are times where I do have imposter syndrome because of the world
Right.
that we live in. Okay, can I do this? Because I wasn't an elite, right? Of course I can. I have 15 years
Right.
of plus of experience treating this particular group of people. I do the research.
Right.
I've seen the cases. I've got people better, and I did run a lot for long
Right.
distances before. But it's just, I do struggle sometimes because I do have younger therapists that are incredible. And, one's training for a marathon right now, and one runs a lot of marathons all the time. And
Hmm.
sometimes I kind of feel like, oh, I don't really do that anymore. Should I still be
Yeah.
doing what I do? And that's a me issue. That's a not
Yeah.
enough issue that you got to work on. But it's true.
Yeah, no, for sure. No, and if Kate mentioned her heart story, if you want to hear more about that, she wrote a book all about it, so you can read
Oh,
that. And I think we even talked about that in first podcast. But it's Racing Heart. Is that the
yeah.
name of your
Yep.
book?
But not that there are some racing heart books out there, I found out later, that are a little
Oh,
racy. So make
it's
sure that
it's
it's
a
the
little dragon
race.
smut.
So make sure that it's racing heart, and then my name about
there's a
running.
there's a there's a heart on the cover, and then Kate is the author, and there's no dragons and no smut.
Which is fine.
Um, which is fine if you're into that.
That's it. That's
This is not that book.
it.
Yeah, so if you want to know more about that, she goes, there's a whole book about it. You could read about that. Yeah, okay. So we've got the app, we've
Mhm,
got the podcast.
mhm.
I mean, I feel like you're also in your part of your career too, where um you've got head down, but it's all about getting better information out to, without sounding corny, like society as a whole. Like,
Yeah.
where do you feel like that turn or that inspiration really shifted? Because I mean, you're on the back half of your career,
Yeah.
like when does it go from that person in front of you to how do I take this and get it to more people and make a bigger difference?
Yeah, I think that when you have a team like I have that you're very confident in the clinic. So again, I love my team of therapists. I think they're incredible. And my precision is 10 years old this year in November.
Oh, happy birthday.
Thanks. So I feel confident that they are doing the things that they need to be doing to taking care of people on an individual basis. And I would see them. I would send my family to see them. I would, all of that. And so
Yeah.
because of that, I am allowed. It sounds like I have been able, I should
Yeah.
say, not allowed. I've been able to make the space to do the bigger thing. And I've always known that it wasn't going to be just me in a room. It was never going to be just me in a room treating a patient. And I do love that. And I still do that. It's just on a smaller scale.
Mhm.
Um, so I knew that I had to do something more because I was frustrated with how healthcare was and how it is. And I didn't like how patients are treated and how disjointed everything was. And I knew that I had the grit and the capacity and the loud voice that could change things. And that's true.
Yeah.
Like you can't be shy and you
Yeah.
can't be afraid to, offend people if you want change. And I want change. I want better for my patients. I want better for all of our patients. I want
Yeah.
better for our runners and our women and all of those things. And at some point, when you're comfortable enough where you are and you have the support that you need, either in your clinic and also, of course, my family, my son
Yeah.
is old enough where he doesn't need me all
Yes.
the time. I have now the capacity to do things on a larger scale to
Yeah.
help the greater good.
Yeah. No, I feel like, especially when, we're lucky enough to have our practices and things like that,
Mhm.
you want to be able to turn around and be like, all right, well, how, yes, my local community has that benefit. How can I, it's almost give back in some ways, because you're like, you want other people to have access to that information too. It shouldn't be, just that privileged little bit, but
Yeah,
love that.
and you see that too because
Yeah.
our community, they really are thriving.
Yeah.
And you ask yourself, okay, well, why are all these other people thriving? And
Right.
even when I treat elite athletes from other parts of the country that come in
Hmm.
for races in Atlanta, I'm always shocked at what they're doing and the care that
Yeah.
they're receiving. And a lot of times they'll reach out to me later and say, hey, you treated me at this race and you said this and thank you. It made a
Yeah.
huge difference. And I think when I look at those situations, it's another way to.
Yeah. I mean that's a that could be a whole other podcast too. I mean, I've been lucky enough to have colleagues in my career that have worked in a ton of pro sport spaces. And so I've gotten to see a little bit how the sausage is made and being pulled in here and there. Um, and it's not always based on skill and expertise. There's a ton of politics involved and a lot of, finessing because you've got money at stake and things that you would assume that these amazing pro athletes would have great resources. And I would dare say 8, 9 times out of 10, they don't.
Yeah.
And I think that's what's hard too when you see a lot of them sharing their experiences because you
Mhm.
don't always know that they're getting the best care.
Mhm.
I mean, we've kind of experienced that a lot watching in the pregnancy postpartum space. A lot more faces get
Yeah.
out there and talk about it and their participation, and you hope for the best for them, but you also don't know what their circumstances are and who's surrounding them. And the only thing that upsets me is when they turn around and put out a postpartum app and they haven't even had their first kid yet. That's when I'm like, oh, okay, I get you need to feed your family, but come on here. Like,
Yeah. Right. It's true. Well, I
oh,
and that speaks to what how important experience is.
yeah,
And who we were 10, 15 years
yeah,
ago, 20 years ago in the beginning of PT and who we are now
yeah,
is very different. And our experience, you can't put a number on that because
yeah,
you can't put a number on how many people we've talked to and connected with and heard their stories and broken down the
right,
stories and looked at it clinically and what we've learned from that and how that benefits all the other patients and all the other people that
right,
learn from us later.
yeah.
It's just you just can't.
Yeah, no, again, the parallels, I feel like especially in the movement space, running, weightlifting, pregnancy, postpartum, like just women in general, I feel like there's been such a huge shift in, I mean, I do not practice it all the same way I did last year, 5 years ago, and definitely not 25 years ago, which is really fun. I'm glad that I'm not doing the same thing. I think I would be incredibly bored.
Mhm.
But sometimes people don't realize how much has changed too. Um, and that's all right. We'll get them caught up. It's all good.
It's true. And actually, even the programs that I wrote initially for RunSource when I started working on it a
Yeah.
few years ago, I rewrote them all for this
Hmm.
version too. I mean,
Yeah.
there's obviously some similarities,
Yep.
but and I made a list of all the content that we needed to film that's based on new research because
Right. Oh my gosh.
um,
Yes.
because we don't do the same thing that we used to do, and
Right.
even the programs. Again, like hamstring tendinopathy, for instance, we
Right.
know that you have to challenge it a lot more now than we did 3 years ago.
Hmm.
And we have to, we always knew about eccentrics, right?
Right.
Um, Maybe not always, but for a long time we've known about it. But we also maybe didn't use blood flow restriction training as much. And it
Right.
wasn't available
It
to the
wasn't a
regular.
thing. Yeah.
Yeah. And it wasn't available to the everyday person. They couldn't
Right.
buy the cup at home. And
Yeah.
so all of these new things that have happened, over the last couple of years, yeah, I practice completely different. I practice differently this week than I did 4 weeks ago. I mean,
I
just
know. It's
keeping up
nice
with the
though.
research. Yeah.
Yeah. Some people would think that's irritating. I don't. I think it just keeps me interested.
Yeah, me too. It's because you have that same brain that I do, that entrepreneurial
Yep.
brain that is constantly like
I need
looking
something
and
new.
wanting to do better.
Yeah, no,
Yeah.
definitely, definitely. All right, so you're busy, and then you mentioned your son. What grade is he in?
He's in sixth grade. Yeah.
Okay, welcome to middle school. How's
Oh,
it
yeah.
going?
So he's great. The only thing I struggle with is he has the gene for the
Oh
genetic heart
no.
disease. That's okay. That I do. And there's they're not really supposed to play a lot of sports, but then they changed the recommendations this
Okay,
year that said, so when we went to see the cardiologist, my cardiologist was like, yeah, you can let him play sports. And for 10 years, I've been told you can't let him play sports. They're like, but you have to have him followed still, and you
right.
have to still watch him. And, we have to do the imaging to make sure. And
Hmm.
so this year he's playing soccer.
Okay.
But I bring in AED and I'm terrified the whole time on the sideline.
Oh.
And so it's so I'm really happy for him because he loves it and my
Yeah.
husband loves it. And it's great. And he even tried out for a travel team that I didn't know what it was. I because I've been running. Okay, I know a
Yeah.
lot about running, but all these other sports I don't really know
Oh,
as
it gets crazy.
and I didn't know that if you tried out for a team and you made it, what that meant. And so he
Oh,
tried out.
honey. I'm sorry. I feel like we need a drink now. Like, except for we're perimenopausal, so we shouldn't do that. So, I don't either.
That's awful.
We can have like a nice electrolyte drink, something.
I can't hear my electrolyte.
Me too. I got element in here.
But yeah, so I didn't know, and I didn't know that he was going to make it, and
Oh,
he made the team, which is amazing. But
oh.
um, I didn't know that tournaments were like 4 games in a weekend, like all these things. I just
Hmm.
had no idea. And so
Hmm.
I
Trial by
actually talked
fire.
about this on a podcast recently, but I had a real live meltdown, like
Hmm.
with tears,
Hmm.
ugly tears at a
Hmm.
tournament in the car when I realized that we had to stay.
Hmm.
So how's it going? It's great. Everything's fine.
I feel like you had like kindergarten through fifth grade smashed into like a weekend course because that's really not fair.
Right,
See,
because yeah.
there's a reason we are not a soccer team or a soccer family. We did a brief foray into winter swim. That is also third circle of hell tinged with chlorine. Um, I'm really lucky. My kids like to try a bunch of different things, but we're not travel people.
No, and
No,
we are not
nothing. Not that
either.
there's anything wrong with it. It's very much the culture where I live here. We are not travel people.
Turns out I'm definitely not. And we've made some I
Adjustments.
adjustments and I
Mhm.
only go to one game a weekend
Oh,
and
good for
my
you.
son is the coolest. He's like a 55-year-old in an 11-year-old
Oh,
body.
that's so sweet.
He just said, Mom, you got to do what's good for you. I
Hmm.
just want to play soccer and I know you
Cool.
love me. And if you can't be there, it's okay.
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 Nice.
Thank you, honey.
That's great. All right. Well, if you need to be filled in on any of the other
Yeah, I'll
middle
call
school
you.
sports drama, well, just text me. I got you. I
Yeah.
still don't. We've done field hockey for, I don't know, 4 or 5 years now. I still don't understand field hockey. Softball, I'm getting at. She started that in first grade. Swimming, I kind of still understand. None of my kids run. And I was like, really? Really?
See, and the thing is, Andy really can't run because of the gene.
Right.
Like that is like the
Yeah.
number one, which soccer is second,
There's a lot of running.
obviously.
Yeah.
But he can't run, and that would be I would love to go to cross country meets, and that would be so fun. And
Hmm.
he's got really good running form, but in certain way, but I
Yeah.
can't encourage it.
I'm secretly hopeful for my daughter. She has the option to potentially do it next year. I think my son, he's got the build for it, but he has no desire to. We're starting with he's trying the precision air rifle club
Ooh,
at his high school.
okay,
I, fun fact, was actually captain of my college rifle team.
you were.
I was, yes.
That's amazing.
I know. It was an NRA college club. And so we used to shoot at like MIT and Army and Navy and all that. What was even funnier was so when I graduated, so it was my 5th year in PT school, I got the female college academic athlete award. I was like, oh, we're counting that. This is me having come from like running and skiing and swimming. I'm like, oh no, it was the rifle girl that she got female athlete.
Wow, that's cool. That's
Fun
really
fact.
cool.
Anyway, so he's got the genes for it. I don't know about the vision, but we'll see. But
Yeah.
anyway, I digress. All right. At the end of every episode, we ask a couple of questions.
Mhm.
You're probably reading just tech books right now. But what's a book you're reading or podcast you're listening to right now?
Oh, I've been listening to a lot of different podcasts, but I do like Smartless because it is not in our genre
Okay.
and it gets my brain. So I'll listen to tons of podcasts about running, and then on my way to work, I'll listen to like a Smartless podcast
Nice.
because it just changes my brain.
Yeah.
And I really like that. And then in terms of books, I read hundreds of books a year, and which is crazy. I don't know where I find the time, but some of it is some of that dragon smut.
Smut.
I'll be honest with you. I love it.
I have been told that calling it dragon smut is offensive, so I apologize to anybody that is, but I don't know what else to call it. So
I actually love it. It's really funny. And I can't believe I'm announcing this on a podcast because
there's a lot of people that listen to it or read it.
It's a little embarrassing, but I love it so much because again, it changes. I'm in such a like logical mindset all the time, and I'm like solving cases all the time. That to listen to something or read something that is out there and different, I really really enjoy it. So I listen to that or read that, and then I'm looking at this book over here that I'm about to start. I really want to. It's by a sports psychologist, and it's about girls and running. I think it's The Price She Pays.
Katie wrote that. Yes,
Katie wrote it, and she's great. I met her at the Female Athlete Conference, and we had talked several times on the phone because I want her to be on the RUNsource app.
Yeah, no, that would be awesome.
And
awesome.
I really, really am going to read that one next because it was sent to me. Dr. Lesko sent it to me a few months ago, and I have to read it.
That's on my to-do list. I'm actually chatting another female athlete author, Maggie Mertens. We're chatting today. She did Better, Stronger, Further.
Yeah.
It took me a long time to read it because I got very angry because a bunch of people telling women they can't do things, and I would just need to take a beat. Next question.
Me too. I get that.
Take beat. Favorite activity since becoming a mom? It doesn't necessarily have to do with your son.
That's funny. Alone time.
That counts.
No, but actually, in relationship to my son, what I really love is our bedtime routine. He's 11, so I'm not sure much longer it's going to last.
Yeah.
But every single night I put him to bed and we laugh so hard. He actually told me that I was childish the other day. And I said, well, most people consider me pretty serious. He said, well, they don't know you. And we were just laughing so much. And we tickle, we laugh, we tell jokes, we read every night. And so that is my favorite.
I like that. Yeah. Hold on to that one as long as you can, for sure. For sure. Who's somebody in your space that we should know about? Who are you fangirling over right now?
That's a good question. Actually, Katie, the book is definitely somebody.
What's Katie's last name? I'm forgetting.
Monroe, I think.
Okay.
I really want to walk over there and grab that book.
That's okay.
I can see it. She's definitely somebody. That's probably who it would be. Yeah, that's probably who it would be. There are a lot of people that come to my mind, but she's the one that I'm focusing on right now because I want to read that
Katie
book.
Steele. Katie Steele and Tiffany Brown.
That's right.
I
can't, obviously I'm not fangirling that much on anybody, but I don't know her last name. She's amazing. And I've had conversations with her and I email with her and I don't know why. I think it's.
But you know her first name, which is Katie, which is really all that matters.
Yeah, it's really that brain, that perimenopausal brain.
I think my brain plate is just very, very full. I'm not blaming perimenopause. I'm just blaming life in general. So.
I've probably always been like this.
All right, for you, last question. What does it mean to you to be an active mom?
Yeah, so I am very active physically, even though I have the heart gene. So I actually lift weights 2 to 3 times a week.
Woo-hoo.
I walk every day, and I have my one run a week with my running partner, and then just chasing around and playing as much as I can with my son, whether it's throwing that hacky sack. I try not to get him to do it in the house, but it does anyway. And then I end up doing it without realizing I'm breaking my own rule, or, kicking the soccer ball or whatever it is, but trying to do all that.
I love that. All right. If you want to learn more about Kate, the name of the podcast is Interdisciplinary Case Miles Podcast. And then you can check her out over on Instagram and all the different places. I'm going to do this. I'm going to do Kate Mihevc Edwards.
Mihevc.
Yes? Oh,
think of it,
Mihevc. Okay, you're going to quiz me next time I see you.
That's all right.
I'm giving you another little flair. I'm like, I like the accent the other way. FB RUNsource, and then at precision PT_ATL. Kate, I'm really not going to mess this up and say it again, but we're going to do it. I'll get you next time. Thank you so much. I can't wait till we get to hang out again in real life. That was so fun to do that at Female Athlete Conference, and I'm excited to give some of those episodes a listen. So thanks for joining me on the show.
Yeah, thank you for having me, Carrie, and I can't wait to hang out with you either.
If you're navigating pregnancy, postpartum, or perimenopause, whether personally or professionally, check out all our free resources and upcoming courses at carriepagliano.com. This podcast reflects the opinions of Dr. Carrie Pagliano and her guests, and it is for entertainment purposes only and should not be considered medical advice. Always consult your healthcare provider with any medical questions. If you enjoyed the episode, please take a moment to leave us a 5-star review on your favorite podcast platform. And thanks for listening.